Thanks very much. Thanks for the very kind invitation to the McCaig Institute and the Wood family to speak here today. I'm actually here to disappoint you for two reasons. One, Paul is an impossible act to follow. I can't possibly do justice to that. And based on the title that I provided, you would think that I would come with some answers. And what I'm here to tell you right off the start is that wearable technology, it is permeating our society. Who here has a smartphone or some type of smart technology? That's the vast majority of the room. Your smart technology is actually quite stupid. And that's what I'm going to convince you of. However, we are leading some excellent research across or within Canada and across the world. And at the end of the day, what I want to do is we'll talk about wearable sensors. I want to send you home with what we call clinical pearls. They're just some really easy to understand advice in terms of helping to manage foot and ankle injuries, which are very common, especially with an aging population. And we'll talk about some future developments in terms of the research that we're working on right now as well. Now, wearable sensors, they are in our shoes, our socks, they are in glasses. They will be woven into our underwear and our shirts before long. This will become part of our daily routine. Our cars will communicate with our fridges, and it's actually a very exciting time. What I do is I try to take vast quantities of data. We apply machine learning or artificial intelligence methods to that data to try to understand one patient at a time. And so really what I'm trying to do is, I know there's a large number of you, I'm trying to speak to one of you in terms of we take all of your data and we just try to make sense of it. And that'll make hopefully a little more sense as we get going along. Wearable sensors, this is one of the fastest growing economies in the world. It's expected to eclipse $94 billion in just a few years in terms of how this technology will be woven into the fabric of our lives. Now, 50% of recreational athletes will experience an injury every year, and you are recreational athletes. So this spans people who garden all the time, people who go for long walks just from a fitness perspective, golfers, people who are just trying to stay healthy and fit. So a large number of you experience running injuries or experience injuries in general. Certainly running injuries is one of my specializations as well. But we deal with a lot of active older adults, and certainly heel spurs or plantar fasciitis that occurs in about 70% of individuals over the age of 40. So who here has woken up in the morning and you take that first step out of bed and your heel really hurts? Let's have that show of hands and just kind of all comfort each other. Yeah, that sucks. So we are trying to use wearable technology to provide you with insights of how can you avoid that in the first place? How can we turn on a warning light using wearable technology? We know that 80% of injuries are below the knee. So there's got to be common biomechanical mechanisms that are associated with knee, shank, ankle, and foot injuries as well. And we have largely failed you from a research standpoint because our in-laboratory research studies haven't really figured out why is that? What are the commonalities in all of this? And that's why for the last few years, we've been moving our lab out into the real world. So I actually haven't used my lab in about 2 years. My cameras are getting dusty. My treadmill doesn't get used all that much because we've been collecting so much data out in the real world trying to answer this question for you. And we have a few things that we can discuss today. So we know that a lot of people, about 88% of recreational athletes, use wearable technology. About 62% are using it to avoid injury. That's their primary reason for using wearable technology. You are a very invested crowd. Obviously, you're here on a Saturday morning to hear more about this. So you are an invested crowd in your own health. You want to know what can you do? How can I use wearable technology from an injury prevention standpoint? Well, there's actually very little evidence at this point in time. Does anyone know where so has everyone heard of like 10,000 steps a day? Do you guys know where that came from? There's no science behind this. I'll tell you that right now. Zero science. This was a motto from a walking group in Tokyo, Japan. And when Tokyo got the 1964 Olympics, the government took hold of this motto and just flat out used it as propaganda to demonstrate that Tokyo is a healthy city. And they just started actively promoting this purely from a propaganda perspective of everyone walks 10,000 steps a day. We are a very healthy city. And then the media got a hold of it, and 10,000 steps a day is just it's a nice number. It's not a number that the vast majority of you should shoot for. And it actually frustrates me. I sit on the scientific board for Fitbit, and it's actually very annoying to me. And I told this, my very first meeting with them, going around the table, it's all very nice, it's calm. Like, Reed, do you have anything to add? At this point, I said, yeah, can we just get rid of 10,000 steps? Everyone was like, whoa, who's this guy with the bow tie? Like, no, we can't. That's hard-coded into our firmware, into the hardware of the watch. We can't get rid of it. And I just said, well, you should, because it's actually not applicable to the vast majority of people. And we're going to talk about that right now. I'm still on the board, though, surprisingly enough. All right. This was one of the first studies where they took a large cohort of you. They took people who have recently been diagnosed with knee osteoarthritis, or they took people who were at risk for osteoarthritis based on a number of different metrics, mostly similar to what Dr. Doyle Baker was talking about in terms of the weight and inactivity levels. So these are people who are at risk or have been newly diagnosed with knee osteoarthritis. They followed them for 2 years using wearable technology. And what they found is that 6,000 steps a day is the ideal number of steps. If you take too few steps per day, only 4,000, osteoarthritis progresses. If you take too many steps, like 8,000 steps per day, osteoarthritis progresses. It's this U-shaped relationship where you're trying to hit that sweet spot. For the vast majority of active older adults, these are people between the ages of 55 and 75, you want to shoot for 6,000 steps per day on average. Now, everyone's got an ideal number. Everyone has different lifestyles. You achieve this in different ways, but in general, this was a really nicely done, well-controlled study, and it's strong evidence to show that 6,000 steps per day is optimal. Now, unfortunately, your device does not celebrate you when you reach 6,000 steps. And that's part of what wearable technology needs to figure out. You know, your balloons only go off on your Fitbit, and it only vibrates when you get to 10,000 steps. So I'm actually working very hard to try to get some of these devices more aimed at you so that it celebrates you when you do achieve 6,000 steps. So we're just talking about setting realistic goals here. That was a very nice study. There was another nice study done in a similar manner. This was an Australian study. They followed thousands of people over 2 years. And what they found is that for individuals, if you took your average amount of steps per day, so whether you know it or not, your smartphone actually keeps track of your activity. There's a little app in there. You can't really get rid of it. For an iPhone, it's a little heart. It's your health app. On an Android, I think it's also a heart. I'm a Mac guy, I'm not quite sure, but you can come show me your device and I'll show you where it is. If you were to look at the average number of steps that you can take, let's say you can only manage, let's say you've got low back pain, for example, and you can only manage 2,000 or 3,000 steps in a day, okay? A great goal during rehabilitation is to try to increase by just 1,000 more steps. So take your average and work on a program to increase it and just get it up to 1,000 more steps. So going from 2,000 to 3,000 over several weeks, that's a great goal to achieve. And then your next step is, can I get up to 6,000 steps? Because that's kind of an ideal for just recreationally active individuals. So this was a study where they took individuals, and those people who were able to increase, who were able to rehabilitate effectively and increase by just 1,000 steps. So some people started high, some people started low in terms of their average number of steps. If everyone increased by 1,000 steps, there's less low back pain, neck pain. It's actually reduced burden on the healthcare system. There's less hospital visits per year for those individuals as well. So shoot for 6,000 and do so in a very moderate way by just increasing by 1,000 steps. And this is just for overall health as well. Okay? So, our research, I work with runners. I mostly work with runners because we focus on healthy aging. We do a lot of knee osteoarthritis research as well. I'm not really going to talk about that. I'm going to talk about what we're doing with wearable devices. And we have a project that I've been calling the check engine light. So hopefully we're all familiar with this. You're driving your car, and your check engine light comes on. Crap. You just know that something's wrong with your car, and the first thing you do is ignore it. And you just keep on driving. But eventually, you know that you have to go see a mechanic, and hopefully that mechanic has some diagnostic tools, and they can figure out what's wrong with your car and get rid of that check engine light. I'm trying to use wearable technology, and we're starting with the running population, and also with active older adults as well. And we're just trying to figure out how can we use wearable technology to turn your check engine light on if something is wrong from a biomechanical standpoint. And here's how we're doing it. We first want to figure out, how do you typically move? Now, everyone has a very unique pattern to how they walk. So we want to measure that. We want to measure what your daily step count is. We want to put little sensors on you that measure how much you bounce up and down when you walk, how much you move side to side, what your cadence is, how many steps you take per minute. So we want to take a whole bunch of data. Then we want to figure out, what community do you belong to? Men and women walk differently. Competitive and recreational athletes walk differently. So everyone has a unique little community or family that they belong to, or a subgroup. So we figure out what subgroup or community you belong to. Then we start looking at new activities. And we determine, are you in the green zone, the yellow zone, or the red zone? I want to use artificial intelligence methods based on all of your data over weeks and weeks of data to determine, do I turn a green light on, a yellow light, or a red light? So here's one example. Here's a whole bunch of dots. So this is 50 runners. We collected their data over 5 months. We have 750 individual dots up there. And every dot is one person for one run. Okay? So the first thing I can do is, there's a little curvy line in there. I can use artificial intelligence to figure out, can I separate these two groups? Because they're two different families. They're all female, but one group in blue, these are people who have run marathons in the past. They're experienced. And the people in green, they're first-time marathoners. They're training for their very first marathon. And they move differently. I didn't really need to do research to kind of figure this out. You can almost look at them, and just based on body types and what they're wearing, you can just tell, like, they are separate groups altogether. But yeah, they mechanically move a little differently. So that's one thing. And then I can group a bunch of runs together. This is one person. So amidst all of these data points, I can collectively take some of that data and I can draw a boundary. This is how one person typically moves. There's the letter T in there. This is their green zone. This is how they typically operate when they're outside on the run path on a Saturday or Sunday morning, and they're just trying to achieve their 10-kilometer run. Okay, they're training for their marathon. And the same would apply if you were just walking, for example. You have a style that you walk in. This is your style, one person's style amidst all of it. Now, one Sunday, this person went for a run, and hopefully you can see this. There's a little yellow dot right there. Well, this person, that's how they ran that particular day. They ran like other experienced female runners, but they didn't run like they typically do. They ran very differently. That's a yellow light. They're doing something very different. I want to be able to send them a text. I want their watch to buzz. I want to tell them that, hey, something happened today. That wasn't quite typical. But if we don't do that, the following Sunday, now they're in the red zone. Now this person ran a very different way. They actually ran like an inexperienced marathoner. And they got injured 6 kilometers into their run. They had to stop. So if we took all the data before that injury, that's what we get in terms of that red zone. So I don't need to tell a runner that they're injured. They know they're injured. But we use artificial intelligence methods to analyze all the data, and I would have liked to have warned them the week before to say, you know what, something's going on. You should go see a mechanic who has some diagnostic equipment to get this figured out. They should go see a clinician who has some type of technology to determine what is going on or get a full assessment from that individual. So that's how we're trying to use wearable technology. And we're also trying to use this in reverse. So if you've had an injury, or you've had surgery, for example, you are already in the red zone. You know that you are injured. You're in pain. And through rehabilitation, we want to show you that you're moving towards a green zone as well. So that's how wearable technology is going to help improve healthcare from that perspective. So there are products available to you. There's a neat company out of Seattle called Sensoria, and they build socks that have wearable technology, pressure sensors built into it. Now the problem is that you can't wash these socks. You got to kind of take the technology out, and then you can wash them, so they get a little smelly. But it's a very interesting approach in terms of literally weaving wearable technology into the fabric that we wear. Orpix is a local company in Calgary that makes a shoe insert that helps detect if you're putting too much pressure on specific areas of your feet. And it's mostly aimed at people with diabetes to prevent foot ulcerations, because a lot of times they can't feel their feet. And they don't know if they've got a little blister, and if that blister is continued on. They don't know that until they look at it and they see it. So this device is actually aimed at proactively sending you an alert that, hey, you're putting too much pressure on that specific area of your foot. And this company, Ultra, they make a Smart IQ. Their IQ shoe has sensors built into it. But again, these devices, as sophisticated as they are, they simply tell you what you're doing. Just like your phone tells you how many steps you took. It tells you what your heart rate is. It tells you if there's pressure. It doesn't tell you what to do. And that's where we're trying to use these methods of data analysis to give you some insight into what you should do next. There's Garmin tools. This is a little device that clips onto the back of your belt that tells you how much you're bouncing up and down and moving side to side. There's other devices that attach to your shoes. There's lots of wearable technology out there. And what we're trying to do is harness all that, because they just provide simple metrics. There's very little insight about what to do tomorrow. Just tells you what you did today and yesterday. And there's so much data, I'm confused. I don't know what to do with all this information. So I'm trying to boil it down to a green light, a yellow light, and a red light. Using really sophisticated math in the background, we're just trying to answer a very simple question. I'm able to do this. I'm really proud that I'm leading Canada's first specialization in wearable technology here at the University of Calgary. I've got a team of electrical engineers and data scientists and entrepreneurs and healthcare professionals, and we're all working together. We have one of Canada's largest training grants. We're going to be bringing in about 80 new students over the next 6 years to be the next generation of experts in wearable technology. So by partnering with professional sports teams and our varsity athletes, our Olympic athletes, we're just trying to collect profound amounts of data to help you. So I don't have the absolute answers for you right now. What I can tell you is you get up and do an extra 1,000 steps, you are moving towards better mobility and health. If you shoot for 6,000 steps on average, that is your optimal green zone. Okay, so try to pay attention to that. But you, the consumer, need to demand more from these companies and from your healthcare practitioners in terms of helping you to use wearable technology in terms of increasing your mobility and helping you to prevent and rehabilitate from injuries. So I'm very fortunate to be funded by a number of actually your taxes fund my lab, so I say thank you to you through the federal government, through Canadian Institutes of Health Research, National Science Engineering Research Council. Here in Alberta, I've been fortunate to be funded for quite a few years by these groups as well. So thank you for your time and attention. I appreciate it. Yeah, thanks, Ian.